Now recognize Ms. Tokuda from Hawaii for 5 minutes of questions.
Thank you, Mr. Chairman. I'd like to focus my time on the benefit of our nation's COVID-19 vaccines and policies in protecting our national security and enhancing our military readiness. My Republican colleagues have suggested that vaccine requirements undermine military preparedness, but in fact, the opposite is true. Increasing vaccination rates in the military, including through vaccination requirements, helped to ensure that our service members were better protected against the spread and harm of COVID-19. These policies worked. In combination with other policies, vaccine requirements resulted in a 96% vaccination rate amongst service members. And most importantly, thanks to these policies, we have not lost a single service member to COVID-19 since November 2022. In the early days of the COVID pandemic, outbreaks of this highly transmissible virus threatened our nation's service members and their ability to carry out missions of critical importance to our national security and ensure our readiness to respond to threats. The USS Theodore Roosevelt, for example, experienced an outbreak in the early days of the pandemic that caused nearly 20% of crew members to become infected and resulted in the crew's evacuation to Guam for 2 months. An aircraft carrier out of commission for 2 months is not military readiness. Around the same time, an outbreak aboard the USS Kidd, a Navy destroyer, caused its crew to abandon their counter-narcotic operations in the East Pacific, forcing the vessel to turn back to San Diego so that crew members could receive medical care. Again, failure to complete a mission is not readiness. Without life-saving COVID-19 vaccines, requirements, and other mitigation strategies, outbreaks such as these could have been far more commonplace and dangerous, a threat to both the health of our service members and national security, disrupting military operations, undercutting our nation's ability to maintain a strong and ready military force. Dr. Lynch, yes or no, would we have likely seen more of these mass infections like those on the USS Theodore Roosevelt and the USS Kidd had we not required vaccination amongst our service members? Thank you. Another yes or no question. It has been alleged that recruits were hesitant to join our military due to vaccine requirements. Do you think that the extensive misinformation campaign that undermined confidence in the COVID-19 vaccination contributed to this likely and alleged hesitancy? Yes or no? Dr. Lynch, from your perspective as an infectious disease expert, was COVID-19 vaccine requirements essential to ensure national security and military readiness by preventing dangerous outbreaks from occurring like the ones we saw on the USS Theodore Roosevelt and the USS Kidd?
Yes.
Thank you, Dr. Lynch. I'd like to elaborate a bit more on the historical context brought up by the gentlelady from North Carolina at this time. For hundreds of years, our military has recognized the importance of immunization to military readiness, dating all the way back to the Revolutionary War. Smallpox ravaged the Continental Army during the early days of the war, including the failed invasion of Quebec. Members of the Continental Congress, including John Adams, identified smallpox as the cause of that defeat. Widespread fear of smallpox in the ranks also deterred new recruits from joining the Continental Army. Recognizing the threat smallpox posed, George Washington ordered smallpox inoculations among the Continental Army in 1777. He acknowledged that this order may pose some inconveniences, but that it would ensure troops were prepared for combat, and it did. Soldiers' reported illness rates were cut by nearly 2/3, which helped inspire a fresh wave of new recruits to join. Later that year, the Continental Army scored a decisive victory at the Battle of Saratoga, and another wave of inoculations at Valley Forge that winter helped ensure the Army was ready for future campaigns. Washington's decision to require inoculations helped win our nation's independence. Today, we have a multitude of vaccines that safely and effectively prevent illness and keep our troops ready for combat. As of 2020, mandatory vaccinations for our military personnel include hepatitis B, MMR, Tdap, polio, meningococcal, and influenza. This is nothing new. Yet my Republican colleagues would like the American people to believe that recruitment and retention issues in our military are a result of COVID-19 vaccine requirements. We know, whether it's DEI initiatives, access to reproductive care, critical race theory, or other DoD policies, my Republican colleagues continue to bring culture wars and misinformation campaigns into our military. But the evidence could not be clearer. COVID-19 vaccines are safe, they're effective, and significantly reduce the spread of the virus. They save lives. The truth is that if Republican leaders who politicized COVID-19 vaccine requirements helped drive recruitment and retention issues, They undermine the operational readiness of our military. They hurt our national security. My time is up, Mr. Chair, and I yield back.